Okay, here we are.
Hey,
Morning, Dr. Garko.
hey, how are ya? Nice to see you.
You too. And I think we're live. So good day, ladies and gentlemen. And thank you for joining the Health and Wellness Show. My name is Wane Elliott. I'm your host. And as per usual, I have my good friend, Dr. Michael Garko, with us again today. And I hope you've all been well. This, uh, this show will air on the Truth Be Told radio network Thursday evening at 8 p.m. Eastern Standard Time. That's every Thursday at 8 p.m. Eastern Standard Time. So I hope you get a chance to listen if you aren't able to this morning here. And the beat goes on in the world of health. Uh, Dr. Garko with us today, and what we were going to discuss was since we're back to cold and flu season, unfortunately, how this can affect us with our cardiovascular system and other issues that we might have. Of course, during COVID, the huge majority of the deaths were folks that had um, heart disease, cancer, lung disease, diabetes. Um, and I believe the COVID was kind of the straw that broke the camel's back. But I think, and Dr. Garko is going to share with us this morning why it's so important to keep our immune systems as strong as can be, as strong as we can, and the effects that can have, and vice versa with our cardiovascular system. So take it away, Doc.
Oh, Wayne, so good to see you, and I always like it when you're smiling.
Yeah, me too. Me
And
too.
having a sense of humor, just as an aside, having a sense of humor is really important, believe it or not, for our wellness. And you have a nice sense of humor. When we take ourselves and things too seriously, we tend to lose our focus.
Yeah.
And it really, quite frankly, does affect our wellness. I know a lot of people think it's just about chemicals and biology and physiology. I get all that,
Yeah.
but there are other things too that affect us. So I appreciate your sense of humor. I just finished, I was up early this morning. I already have done 3 radio interviews and a TV interview. And
Wow.
on all of them, the media is just zeroed in on cold and flu, and for good reason. What's interesting, Wayne? For years we've been calling it cold and flu season. That it's going to change now, and I've been saying it. I'm waiting for others to catch on. It's not just cold and flu anymore. It's
No.
cold, flu, COVID-19, and RSV. RSV is respiratory syncytial virus. That's what that means. All 4 of these viruses, Wayne, are in the system, if you will, as we speak. Cold season started at the end of August. Flu season started at the end of September, beginning of October. COVID's been in the environment and it's still there, and RSV is there too.
Yeah.
These 4 viruses in combination can be a train wreck for people this coming winter.
Yeah.
And so today I thought there's 2 things I thought would be helpful for us to talk about. What is the difference among these 4 viruses? What do they look like in symptomology? And why is it that cardiovascular morbidity, having cardiovascular issues, makes getting infected with these viruses, especially influenza, worse, and why influenza has an impact on cardiovascular system, especially those people with an existing cardiovascular condition.
Yeah.
2 very important themes. I think your audience will appreciate what we'll share with them today.
Well, that's great, Doc, because that's what we that's what we endeavor to do on this show, is to provide information that hopefully help people, and maybe they hear some things they hadn't heard before, and just tips and clues to try and stay well. That's what we're all about, as you know. So
100%.
go
And
ahead and start that off, Doc, and educate
sure,
us.
there are the four viruses that we are going to talk about, and you should be concerned about them too. That those of you folks who are listening and watching today, the flu, influenza, common cold, RSV, and COVID-19. The flu is caused by influenza virus. That's worldwide, has a seasonal cycle. It comes back every year, typically starting in the fall, lasting through spring. It causes high fevers, coughing, body aches, and other respiratory symptoms. All of these viral infections are respiratory related. Common cold is caused by the rhinovirus. It comes with little milder symptoms than the flu. Flu tends to lay people down. The cold, they can walk around and do stuff. But the the rhinovirus is serious. Runny nose, slight cough, other, chest discomfort. Although everybody experiences illness differently, in most cases, if you have a cold, you can still function. However, with the flu, if it's really a virulent form that you got, you can be laid up in bed. RSV, something new to the scene for a lot of people. Respiratory syncytial, funny word. Respiratory syncytial virus is a respiratory virus, syncytial virus, which can affect the respiratory system. It'll affect the nose, the throat, the lungs. In most people, this virus will present itself like a cold. You'll think you have a cold. Well, you'll have a cough, runny nose, sometimes a fever, but it can be more dangerous. Make no mistake, in infants, RSV can cause pneumonia or bronchitis, and people over 50, those with heart or lung disease, are at risk for further complications. Last but not least, COVID was a pandemic, and you made this point a few weeks back. It's now endemic, meaning that it's going to reappear it's going to stay in the system. It's going to appear and reappear just like influenza. So now it's endemic in nature. It's caused by acute respiratory syndrome coronavirus, sometimes coronavirus 2, called SARS-CoV-2. This is a very serious virus because of its high mortality rate. A nurse told the story, and I saw her do it. And she had a patient. She was in the room where, it was pretty serious. And the patient is on a respirator. And she asked the patient, would you take the virus? He's getting ready to die. They're trying to save his life. He refused to take it. That's fine. But he refused to take it for political reasons. And I'm thinking, what are you doing? I can understand refusing to take it because you think that it's going to do this or that. You're about ready to die. What in the devil do you have to lose? I guess what I'm trying to say is that this virus is deadly. And I know some people with the vaccine, I think that's a personal choice. I personally have taken them and got the boosters because of my age and medical history. I felt that that was in my best interest. Others may choose not to do that. I have clients and I help them with their immune system, which we'll talk about today. So if you're going to refuse to take a medication, take it for a good reason, not for a bad reason, I guess is what I'm saying. So this virus has fever, cough, runny nose, body aches. You can lose your taste and smell, and it can hospitalize you. For the most part, children seem to fare better. Older adults seem to have a more difficult time. Yeah. So those are the four viruses. Generally, they're going to be with us this winter. So the Strauss immune support products, the four of them, immune support, cold storm, the smooth oregano. These products are fabulous. They will support your immune system, and I highly recommend them. We'll talk more about that.
Yeah, as you know, Doc, I didn't get vaccinated. I just couldn't get my head around it, truthfully, and
It's
didn't
okay.
trust. I didn't trust. I don't trust Western medicine. Period. Really. Um, uh, but the and I don't know if the same kinds of things are happening in the United States as here in Canada. You might remember me telling you, Doc, a year ago, August, I was on a job out in Nova Scotia, and one morning had some pretty severe pains in my lungs, and I went to the hospital. They called an infirmary there, but I went to the hospital, did a bunch of tests, and what really bothered me was after all this testing and number counting and number reporting, the doctor said to me, "Your issue is you have a virus on your lungs." And I said, "Okay." He said, "You know, the one that's been going around for a couple of years." He didn't name it. He didn't say COVID. I said, "Yeah." He said, "It could be that one or it could be another one." And I found it really strange that they did not want to know. But at that time in Canada, they had stopped reporting numbers. They had
Hmm.
stopped reporting all numbers. We went from, they drowned people in numbers, many of them false, of course. Uh, and then all of a sudden stopped and did not want to know. I was kind of shocked, to tell you the truth, Doc. He didn't want to know because you'd think that maybe he would cut me loose with some instructions like, "Oh, it turns out you have COVID, so you best um, what do you call it? Stay by yourself." I can't think of the word right
Yeah,
now.
isolation. You
Isolation. You should
quarantine yourself.
isolate. I
Quarantine.
was cooking for 20 men. Uh, well, it ranged from 16 to 25 is what I was doing on the job, shopping and cooking for the fellas, picking up the occasional parts and so forth. And as it turns out, I actually never missed one dinner. I went home that day and um, took, a bunch of the Strauss formulas. I also started that day drinking a quart of pure lemon juice,
Yeah,
which seemed to really help me. That smooth oregano, that is one powerful formula, Doc. Uh,
absolutely.
one powerful formula because um, I didn't get rid of that virus on my lungs. I know it until when I had COVID for the third time back in May. That's when I got rid of the virus on my lungs. I know it. Believe me, you can tell when you're when you have a virus on your lungs and when you be rid of it. And really,
Absolutely.
the only thing that I added religiously a couple of times a day, in fact, up to 3 times a day, was that smooth oregano. And I can take it. I was never able to take the oil of oregano. It was just too hot for me in my
Yeah.
mouth and it would give me indigestion. But the smooth oregano didn't do that. But powerful it is, Doc. I'll tell you, very powerful.
It's oregano, oil of oregano, and of course, oregano, the herb, in dry form, has been in food cultures around the world for hundreds, if not thousands of years.
Yeah.
I mean, that plant is really special. It has antiviral, antibacterial, antimicrobial properties.
Yeah.
There have been studies to show that it's very unusual for herbs to be able to battle with viruses
Right.
and win. It's very difficult. Oregano, you mentioned oil of oregano, so it can be very harsh, right? It
Yes.
can have a
Yes.
burning sensation. There's a reason for that.
Yeah.
But nevertheless, it's the carvacol in that compound. Nevertheless, it really, and beyond using it in culinary and cooking and whatnot,
Yes.
it has been a medicinal giant in the botanical world for centuries. And Strauss has figured out how to make it smooth, hence the name,
Yeah.
smooth,
Yeah.
and it tastes great. Uh, what I've been recommending to my clients, I have a couple now that are sick. I have them doing the immune support drops, and they're not traveling, so I don't have them on the travel bug, but they got the smooth oregano, the cold storm, and the immune support. I have them taking 3. Now, if they were traveling, I would have them do the travel bug as well. So they're
Right.
taking 3 of the products, and I'm getting a good effect. Their symptoms are less severe. They were
Yeah.
already infected. So
Right.
they thought, well, they said to me, Dr. Garko, there's no use now. I said, no, no, no. We can try to moderate the signs and symptoms a little bit. And
Yeah.
lo and behold, for the past 10 days or so now, they've had good results. So once, even if you're infected, you can still take the products and get a good effect.
Yeah. I was so pleased to lose that virus. Geez, I carried that for almost a year. Um, I'm surprised it didn't take me down before it did, to tell you the truth, Doc. But yeah,
Did you ever figure out which virus it was? Did they ever tell? Did they ever test you to tell you?
no, no, they didn't. That's what blew my mind. Them not wanting to know and
Well,
not wanting me maybe to isolate.
Well, I don't understand that. That's unfathomable to me.
I hear you.
You've heard me. You and I have been together a long time. You hear me with that. My quote from Bertrand Russell. He said, "I would rather be mad with the truth, meaning crazy, than sane with lies." Tell me the truth, man.
That's right. That's
Just
right.
tell me the truth.
Well, our as I'm sure you've heard and read, Doc, as apart from just talking to me, our medical system's a mess. When I got the inflamed heart, the myocarditis a few months back, um, they put me through a lot of tests. I went did and had a lot of tests. I don't have the results of those tests because my doctor who referred me, this is back now in April, referred me to a cardiologist. I haven't heard from the cardiologist yet.
Oh, for
So
goodness sake!
I don't even have an appointment, which will mean the appointment will be next year. Uh, so it'll be, let's see, it's been 5 months now, in October, November, December, 8. I'll bet you it's 10 months before I get to see him. And I don't
Well,
even know if I'm going to go now because uh, there was one test result I really wanted, Doc, the echocardiogram. And I had the test. I just don't have the results. And it's pretty easy not to trust the system here in Canada.
what if,
Uh,
Wayne? What if you were to get in your vehicle and go to a hospital and and walk in and say, "Look, and just present yourself and let them deal with you"? Would they treat you then? Would they tell you then? I mean, what? Or do you have to drive across the border to the U.S.?
I did think about that. Go to Buffalo. My sister's done that before for different things when there's a 6 month or a 1 year wait here in Canada. I
Oh
mean,
my God!
people die in this country, Doc, waiting for health surgeries and so forth. And of course,
Well,
COVID did not help that situation. It just put us that much further behind. They just approved. We're so short of nurses, and then when they forgive me, but when the idiots in charge fired the nurses who wouldn't be vaccinated. Now, these nurses are educated people. They watched, all kinds of people with COVID. They watched all kinds of people vaccinated and so forth. And there were apparently 10 or 15% of our nurses chose not to get vaccinated. Well, they let them out of their jobs. And then of course, we were so short of nurses, we were burning out the nurses that were still working. So
yes,
they've just now approved 37,000 foreign nurses who before had no chance. I don't know if the US is the same, but you can be a
no,
doctor in Cuba or Venezuela. Well, you're not a doctor when you come here. You're not an engineer. They
right.
don't allow any of those certifications. They don't. I would have thought it would have been smarter maybe to have a test. Make them do a couple of exams to make sure they're up to snuff. But no, they didn't do that. Now we got in such a desperate strait they approved 37,000 nurses to give them nursing tickets in Canada to be nurses. Um,
Well, you know what you're sharing with me, uh, even underscores. You know what happens. You know, this is interesting. A couple of points. What you just shared with me tells me that if I lived in Canada, I would do everything I could then to take care of myself.
Yes.
Because if I wait on that system, I will more than likely make acquaintance with the funeral director before the doctor.
Well,
And
yeah.
so I'm going to figure out, how do I do self-care in a responsible way? That is why this show and shows like it that take a evidence-based approach are important to the community. What I share with you, with your audience, today I got 3 more shows to do across the US. My name and my brand and who I am is on the line. I can't go out there and say ridiculous things.
Right.
And everything I'm sharing is evidence and science based. So for your audience that are living in Canada, when Wayne and I share with you the idea of these products from Strauss Naturals, they're not the end all and be all. They're not going to raise Lazarus from the dead. They're not intended to do that. They're intended to support you in your systems, your cardiovascular and immune system in particular here. Yeah. So that's part of the story, but there's diet and lifestyle as well. The supplements can be a good strategy, but they're not the total answer. I just want the audience to know that's the truth. Yeah. But they can be very effective. Yeah. But if I don't know what I would do, Wayne, if I were, look, you're my friend and my colleague. And you got family there. I mean, I'm concerned. I'm saying, what if something should befall you? And how do you get to a doctor there, for heaven's sake?
Well, I mean, there's I've heard of wait times. You can easily wait 8-10 hours in the emergency room. I had it wasn't a friend, but an acquaintance die in the emergency waiting room before he got looked at. So I tell you, every time I hear Hillary Clinton used to talk about boasting about the Canadian healthcare system and wanting to mirror it in the United States, and I've said many times, don't do it. Just don't do it.
Don't do it. Huh?
It's a failed system, and
I wonder, really Wayne. You really got me thinking now. I'll have to go and do some research, and I will check other countries that have socialized medicine to see if they have a dumpster fire situation or something better. Is all socialized medicine?
Cuba has that. Yeah, Cuba has a socialized system, Doc, and I've heard it's very good. And of course, with the embargo, a lot of their pharmaceuticals that may originate in the United States go to Spain, get relabeled, and then back to Cuba. So they must be very expensive. But I've heard their healthcare system's very good. Now, maybe the doctor to population ratio is different, is better. I don't know.
I do happen to know a little bit about that system because I have friends who live in Cuba, and one of my ex-girlfriends
right
was from Cuba, right. And she's a wonderful person, and she was a nurse in Cuba, and her 2 sisters are nurses. They left Cuba and went to Spain to work as nurses. Right? My friend told me, she said she brought her parents over here because there was no food. Her parents are elderly, and there was food scarcity. So out of conscience, she had them. It took a long time, but she got them here to the United States. They now live with her. Right. But she said that what they do have a good system, but they don't have enough supplies. Yes. They run out of supplies, they run out of food, they run out of medications. But the doctors and nurses are well trained, but they don't have the supplies and the materials to help people.
Well, there's a difference in Canada. I just read again the other day that we have, I think it was 48 million doses of a vaccine that's about to hit the end of its shelf life, his best before date. and our prime minister is trying to sell them or give them away somewhere now. I don't know why there'd be so many. There's only 35 or 36 million of us in Canada, but anyway, yeah, the healthcare system's nothing to boast about
Wow.
here. It is
Well,
free. If you had a heart surgery tomorrow, there's no bill comes with it. It's no charge, but good luck getting there if you need it. And I guess not everyone is waiting 6 months to a year, but there's enough people that are, doc, that it's just not good. And one thing I wanted to mention, the travel bug. Health Canada insisted that we put on the bottle that it's good for upper respiratory, which I thought was great. But I have I'm anxiously awaiting from two young ladies expecting babies, and it's safe for expecting moms. The travel bug. It's really for nausea, motion sickness, and nausea.
it's
And
for stomach upset. Yeah.
So I'm really anxious to hear how they make out with it. The one young lady just got her bottle on the weekend. Her dad brought it to her on Saturday, and the other one is here in Niagara. Um, and I'm hoping it helps because I know from my other daughters-in-law it can be, you know, it can be pretty nasty. This morning sickness. The one my one son's mate, she was sick the whole 9 months, and
Oh,
so I'm really anxious
wow.
to learn that this works for the morning sickness as well. But uh,
Yeah.
I mention it because with that upper respiratory benefit, not only is it a great thing to take when you're traveling, doc, but I think it may be a great thing to take otherwise if you're experiencing some difficulties.
Yeah, it's been the travel bug has extracts of fresh garlic bulb, fresh ginger, the rhizome, and ginger extract from the rhizome. So it's good for your gastrointestinal, for stomach upset, nausea, and motion sickness, but it also supports the immune system. The travel bug is terrific. People are going to be traveling during the holidays. That should be with you during the course of your travels and before, and taking immune support as well. I, you know, it's I trust your judgment and your report to me about having. I didn't know you had to wait. Hell, I would have come up there and forced you to drive across the border. I mean,
Yeah.
you were in bad shape. Uh, my God, you sitting there waiting for help from the medical system. It's crazy. I that's a crazy story. I mean, I just don't believe. I believe it, but it's hard to grasp that you've been waiting. You haven't even heard from the cardiologist.
No, no, which tells me now that we're into October, the appointment will definitely be in 2024. Um, it's yeah, it's a terrible. Uh, I was referred to a lung specialist, and I saw him 2 weeks ago. So that was just over 4.5 months. Not near as bad, but it's not like for things like hip and knee replacements, doc. Oh my goodness. I have one buddy that's I guess he's 2 years. 2 year COVID really threw that into a tailspin. They said between hospitals not having the staff and patients themselves not wanting to go to hospitals during COVID for fear of perhaps catching it in the hospital. It wasn't
Yes.
all the medical system's fault, the backlog there. But this one doctor came on and said, um, when we talk about getting back to normal, you must realize the hundreds of thousands of surgeries that have been delayed or postponed that
Yeah.
that didn't go away. So it's like we'll never catch up here. It was always a wait. But if you consider what he said, hundreds of thousands of surgeries that have been postponed or delayed, uh, how do you catch up? So
Yeah.
uh,
Well,
If this happens to me or anything like it again, I will have Buffalo's only uh, 40 minutes away by car, and you can get open heart surgery there tomorrow. You know, it's not free. It's not free, but you can have, and I'm not
well,
exaggerating. You know,
I would rather pay for the surgery than pay for the funeral.
right? That's right. That's
um,
right.
there's the other theme that we wanted to focus on today, and would remind the audience that if you go to straussnaturals.com and type in truth, you'll get a 10% discount on your order. Please do that. And everything's 100% satisfaction guaranteed.
Yeah,
No questions asked. Uh, if it works, it works. If it doesn't, well, they'll refund. You don't like it, they'll refund your money.
yeah.
If you're in a bad mood, just happen to be in a bad, that doesn't make no difference. We'll refund your money.
That's right.
So,
Yeah, there's
wanted,
no dissatisfied customers that have been cheated, or if you will, for their money, Doc. That's
no,
for sure.
no,
On that point, what's a little heartbreaking for me, uh, um, it's this inflation that we're suffering and continue to suffer. The interest rates, which are just really hurting people on mortgages and so forth. Um, Anybody that needs a car, the interest rate now up much higher. I can see that it has, and it's you know, I don't think of these products as a luxury, but let's face it, you've got to feed the family, you've got to get groceries, you've
sure.
got to fuel your car uh, to get to and from.
Well,
And I'm afraid that over this past, you know, between the inflation and the high interest rates, there's just a large block of people that could no longer afford these products, and it's a shame. In Canada here, Doc, instead of the government, giving people what they want, we all know there's no harm comes to anyone from these products, just like there's no harm from eating fruit and vegetables. But they're making it more arduous and more expensive, and heavier restrictions yet. They're putting license fees on manufacturers like Strauss. It's just, well, it's a combination of money grab and big pharma trying to put the
sure.
natural business out of business. Truthfully, is
Well,
what it is.
they can. Same thing in the United States. By the way, the FDA, FTC, FDA in particular, cracking down real hard on dietary supplement companies who are violating the regulations. What the audience should know, if they notice, you never hear me make medical claims about any of these products. You'll never hear me say that the Strauss Heart Drops will lower your cholesterol. You'll never hear me say the Strauss Heart Drops will lower your blood pressure. I'm not permitted to say that.
Right.
What I can say is that the Strauss Heart Drops will support your cardiovascular system.
Yeah.
So we live in a new time. And even though there are thousands of studies, for example, Wane, on aged garlic extract and how aged garlic extract can lower cholesterol, how it can lower blood pressure, how it can create a better lipid profile. Yeah, I can talk about that all day.
Yeah.
But the minute I tie that to a product,
Yeah.
I can get into trouble.
Yeah.
So that's why, if the audience is wondering why you never hear me make those kind of claims, is because Health Canada, FDA prohibit us from doing that. And I get it, and I follow the rules.
Yeah.
So we're good. But what I can say, for example, right now, is that there's a link between influenza infection and cardiovascular morbidity. And if your cardiovascular system is compromised, morbidity, meaning you have high blood pressure, high cholesterol, whatever, influenza can really be a worse event. Hence, the heart drops will support your cardiovascular system. And in the event you get infected with influenza, you're going to be better able to cope with that infection. Yeah. We've known for over 100 years, Wane, that the connection between the virus infection, like influenza, a virus infection, and cardiovascular dysfunction it can be a train wreck. We've known that for a long time. So the heart drops are now even more important to take, and the immune support products even more important to take, because influenza will affect your cardiovascular health in a very significant way.
Yeah, there's no doubt in my mind, Doc. And to me, it's I don't know. I believe it's evil. They're selling tens of billions of dollars worth of man-made chemical drugs, and relatively speaking, for the bit of natural products that are sold comparatively, and the no harm, it's to me it's criminal what they're doing. But and I'll tell you that myocarditis, I was thinking about this, Doc, that I've gone through, and my blood pressure still isn't consistently normal. Um, it's not. Um, but I am convinced that had my heart not been so strong when I got hit with this, uh, I think it would have taken me. I really mean that, Doc. I mean, they last August in Halifax, they said it's quite. The doctor said to me, it's quite something. You're whatever I was, 68 years old then. He said, we don't expect to see this. We don't see it. And the words he used is he said, I had the heart of a young bull. My heart was so strong,
Well,
and that wasn't the problem. And I think had it not been that strong, Doc, with what I did suffer with the myocarditis, I'm not sure I'd have been here otherwise. I mean that.
well,
It was nasty.
you've been talking about this, and people, they're saying, well, Wayne is not a scientist, so he does. You are right on the things that you say. I always check your work, that, and
Yeah.
99.9% of the time I find science to support what you say. It turns out that cardiovascular complications of influenza are real. They lead to vascular complications, myocardial infarction, stroke, pericarditis, myocarditis, heart failure, all these myocardial cardio complications. When you got infected with COVID, it was affecting your you had myocarditis. Maybe you didn't put that together at the time. I would kept thinking, geez, I just wonder if the COVID exacerbated the myocarditis. Sure enough,
Yeah.
there's a bunch of research to support what you've been saying all along. So it's real, Wayne.
Yeah. No, there's no question about it, Doc. And so again, and we've said it many, many times that prevention and planning and trying to stay healthy, not just when we don't feel good or we're sick, but you're as in the case of myself with a very strong heart for my age. I was very fortunate. So it's just important to prevention. An ounce of prevention's worth a pound of cure. That's an old expression. It's very true.
It is true.
Uh, if and anybody who's had a heart attack or a stroke may tell you the difficult journey back to good health after those. It's not impossible, that's for sure, but
Yes.
better to prevent in the first place if we can, and to stay healthy is certainly the best thing to do.
So, one of the things that my clients say to me all the time, they say, Dr. Garko, you tell me all these things to do. And I talk to them about prevention and preparation. And they say, I can't do everything. Some of them can't afford to do everything. Some of them just don't damn want to do it.
Yeah.
And some just find it inconvenient. But they're very honest. They say, I just can't do everything. What can I do? So I'm forced to focus on specific. And I know from experience in my training that your digestive system is critical and your cardiovascular system is critical.
Yeah.
And the immune. If I can get them to take care of one of those three or all three, they're going to be on a better road.
Yeah.
So it just turns out that, cardiovascular, immune, and digestive, those three systems really account for much of the variance for your health, wellness, and well-being. That brain is not going to work right. Nothing else is going to work right if you're not pumping oxygenated blood and nutrients to all the cells, tissues, and organs. If your pump is shot, and if you can't digest your food and absorb it, how are you going to get those into your system? And the immune system, if it's compromised, you get sick, you're a goner. So that's where we focus. I thought about our conversations on air, and usually they center around those three systems because they're vital. So Strauss Naturals is dialed into this, and I've had good response, Wayne. From I go back on shows, I get invited, then I get invited back, and then again and again, and the hosts tell me that the audience wants to know what more about these kind of. They're looking for information and help, and they're so grateful, and we're getting a good response. So ask Dr. Garko at Strauss Naturals is a link, and I answer everything. As you know, Wayne, I share that with you. I answer every person that writes to me, question or comment. I answer right away. If you do have a question or comment, don't hesitate. Don't be shy. I'll help you the best way I can. If I don't have the answer, I know somebody that does.
Oh, you've always done a great job, Doc, evidenced by your own radio show for 15 years. That's how we met years ago, and so you've done a great job. I mean, ignorance isn't really always bliss, is it? I mean, it's like you're saying, the truth. The truth is what's important. I think one truth that we all know, but as the days go by, I don't know what you say. I always believed it, but I'm believing it stronger and stronger. Is these refined sugars, refined carbs? Boy, oh boy, I they're not poison, but by geez, they're not too far off it, Doc. I don't
Well,
think.
I talk about nutritional toxicity. Salt, sugar, and fat in high doses, unhealthy fat, the refined carbohydrates, and excess sodium. By the way, we need sodiums. You shouldn't eliminate from your diet.
Right.
This nutritional toxicity that you're alluding to is real. The refined carbs upset the blood glucose balance, and you get too much. The body does not like to have sugar and insulin floating through the system. It just doesn't like that, and you end up with type 2 diabetes, become overweight, obese, and it also implicates then the cardiovascular system and other systems of the body. So your point about these refined sugars, they are toxic at high levels. These processed. I was watching football the other day while I was working. I had it on, and I one commercial after the next was about fast food. All day long, fast food. I mean, every fast food known to humankind, I think I saw on Sunday. I couldn't believe it. I said, my God, no wonder we are in such terrible condition. And people are influenced by those foods. They're very addictive. So these refined sugars are very toxic and deadly to the body. And it's real. Like you just said, it's real.
Yeah. Doc, excuse me. I'm not trying to put you on the spot or anything, but lately I'm reading that some medical professionals are calling dementia type 3 diabetes. Can you
Yes.
give us some explanation of that, please?
Yeah. Yes, because again, when you are insulin resistant, it's going to affect all. Insulin is a hormone, and it has such a tremendous impact. Hormones are created in one place and then travel out and affect other parts of the body. And it turns out that too much insulin is having some neurological consequences as well. And we see that people with diabetes, there's a correlation with diabetes and dementia, diabetes and cardiovascular disease,
Yeah.
diabetes and kidney disease. So it's not surprising that and it's all about that one. That's why glucose and insulin management is so critical, right? You're right. It is. It is now called, another type of dementia. This insulin resistance leading to this neurological dysfunction. It's
Yeah.
all like you often say, everything's interconnected,
Yeah.
and it is.
Yeah. Everything connects in our bodies, Doc. And I think that many people, when they think about refined carbs and all the lovely, tasty baked goods and so forth, chocolate and candies and whatnot, um, I think people mostly think of weight control and weight gain and of course those things, just like the GMO wheat, can absolutely make you gain weight. Um, and not to downplay that either. We've talked about how obesity is a path to poor health and disease, but you've just pointed out these other things in our body. It's they're everything does connect. So these sugars and refined carbs that we really shouldn't eat, nature didn't create them, man did. They can cause a lot more problems than just gaining weight, can't they?
That's right. And I just, as you were talking, I went and I checked this relationship between diabetes and dementia. And there are multiple reasons why that happens, why type 2 diabetes may lead to dementia. One reason, to what we've been talking about, is related to the effects of diabetes has on the heart, as heart health is related to brain health. Heart disease and elevated blood pressure are both associated with strokes that in turn can lead to dementia. However, strokes do not appear to be the complete answer, as some studies have found that diabetes led to an increased risk of dementia even when strokes were controlled for. So you see how these systems are connected? You have diabetes connected to heart health, connected to brain health.
Sure, sure. Well, for years, Doc, this bothered me for years when I learned that um, diabetics have a 4 to 5 times greater chance, 4 to 500% greater chance of suffering heart attack and stroke than those who do not have diabetes. And what bothered me as much, to be truthful about it, is that this report years ago said that 85% of diabetics were not aware of that.
Yes.
So again, it's not just as simple as taking a pill or, uh, you know, uh, uh, even insulin. That there's everything does connect inside us, and now that that's even related to dementia. I mean, it's when something's bad or not good for us, it's not good. It's not good for part of us and bad for another part of us. It's just
No,
not good, right?
no, biology doesn't work like that.
Right, right. I mean,
Biology
it'd be
doesn't.
nice. Oh, geez, it's 8 o'clock. We can eat the rest of that blueberry pie, Doc. No, we don't. We don't
No,
want to eat it after 10, but we're okay now.
no, no.
It's
Well, like you say, being delusional. There's some bliss in that. I used to say to my students, I would say, "Look, you can be ignorant and not know. Okay, you can. Then you can go research and find out. Then we all do stupid stuff. I get that." But when you're stupid and ignorant together, then you're too damn dumb to know what to do. So don't be stupid and ignorant. Be one or the other, but not both.
uh, I'll tell you, it's you know, we all know that we need veggies and fruit in our diet, but the blueberries in the pie don't really count, Doc. The cherry pie doesn't really count. You know what I
No,
mean? That's not what they mean.
I had
So
a, I swear to you, this is true. Had a When I was doing my show, I had a caller call into the show, and he said, "Well, I get my vegetables." I said, "Well, how do you do that?" He said, "Well, when I get my burgers, I always have them put lettuce on it." I
now,
said, "No, man,
now
that's
that
not going to get it
when I
done."
have a burger, tell you the truth, I have lettuce, onion, sometimes tomato. and none of the other goop, none of the ketchup, relish, mustard. So it is better than having one fully loaded, but I don't think I don't think that's going to add up anywhere near the
No,
vegetables you're supposed to have in a day,
no,
right?
it's not.
And then I'll see people take the lettuce off their hamburger, and I'm thinking, oh boy, you
And
know.
then he said, why have potatoes? I said, what kind of potatoes? He said, French fries.
Yeah,
I said,
right.
no, man, you got this all upside down.
Yeah. But look what we're sold, Doc. You said it earlier, uh, watching the ball game, how all the fast food commercials
One after
and
another.
yeah, so I'm thinking back many years ago, over 40 years ago, when my sons were very young, and how much effect the McDonald's hamburger chain commercials what an effect it had on the children. There was the kids' toys or whatever they call them in the Happy Meal, and the some of them have the play areas with slides and so forth in the stores, and you know they really uh, they hook the kids when they're old enough
Oh, yes,
to
because
know what they're watching.
it's
Something.
addictive.
Yeah.
It's addictive. I saw a cartoon somebody sent to me. There was this man in the ocean, and he had a tube, and he was really obese. He was really fat, and there were two sharks saw him come into. He was in the water, and the two sharks were talking to one another, and one shark said to the other, he said, it's tempting, but too much cholesterol."
I thought you were going to say that they were afraid that he'd eat the sharks.
Even the shark said, "No, man, the fat guy, too much cholesterol."
And Doc, it's I know some of these folks. Some men and women are very busy, traveling salespeople, always on the go and so forth. And I know that there's people that are eating the fast food once or twice a day, at a minimum, and I don't know if it's possible to maintain a healthy weight if you're doing that. I really don't. I mean, there's a
Can't
lot of negatives
can't do
in
it.
that food between salt, sugar, and the fats from fried foods.
Can't
Boy,
do it.
oh boy, it's a recipe I think for disaster. Honestly.
Well, I don't know I have to look what it is in Canada, but in the United States, now we're close to, and you can check my work, go to the CDC. Nearly 75% of the population in the United States of America is either overweight or obese, with 1/3 of them being obese. That's not a fiction, that's a fact.
Yeah.
Think about that. 75%, we have over 300 million people. And as you have pointed out time and again and over and once more, when you are obese, everything else goes to crap, right? Your health just caves in on itself. So I don't know how the system is going to sustain this
No.
in the long run. But
No.
I
And
hope
then
that we have some influence on the audience to at least consider some of these changes that they need to make in diet lifestyle.
well, sure, Doc. And on top of all these diseases and ailments, how about our bones and joints?
Oh,
I mean, sure, our hearts are all supposed to be, the same size, and so the heart's got to do so much more work. But how about the ankles, the hips, the back? We're just not meant to carry
too
the
much
loads
load.
that we're carrying, and it's just all bad. So, really, it's a shame. It's funny. They really restrict the advertising and what we can say about natural. I want to in capital letters, natural health products, and yet what these sellers of death are allowed to say, the fast foods. And in Canada, Doc, about, geez, I'm going to say close to 10 years ago, Health Canada, one day, one time I heard it said, um, there is more salt in a quarter pound, so that's the small patty. There's more sodium in a quarter pound drive through or fast food hamburg patty than humans can tolerate in a day.
Percent,
Tolerate. So
absolutely.
now, did they change the law to say you must limit it? No, they left it voluntary. And so what's the big craze since? Reduce sodium. Look on the label. They reduced it 1% or 2%. It's a
Yeah.
preservative. It's used as a preservative. These canned soups, I can't eat them anymore. They're so
No.
salty to my taste. I only use sea salt. And, uh, so it's just, it doesn't seem right to me. I realize it's a mega $1 billion business, the fast food business, but they mentioned it once, and left it voluntary to the food companies to reduce sodium. And so now they put it on the label, doc, raise the price a little bit, and you're supposed to feel better at
Yeah.
1% less salt. What I
Well,
checked was the worst was vegetable juice, tomato juice.
oh,
And I'm not going to mention brands, and
don't.
I was never crazy about it, but I had this real taste for it in Florida once. And I thought, I'm going to, that's really as appealing to me right now. And as I round the corner with my cart, there's a wooden skid piled with I'm not going to mention the brand, but vegetable juice. And I picked up the 2 quart jug, put it in the tray, the cart, and I picked up a second one. And I thought, wait, let me 27% sodium, doc.
Oh,
20. So you drink a quart, you're getting a glass of sodium, table
sodium.
salt.
Well,
So I
my
haven't had it since.
here's a quiz for the audience. What is the leading cause of death around the world? Answer: unhealthy diet. That is the leading cause of death.
Yeah.
Diets that are constituted of processed foods, these super concentrated foods of salt, sugar, and fat, with chemicals and other names that you can't even pronounce. That is the leading cause of death around the world, an unhealthy diet. Make no mistake about it.
Well, I used to think of the old days, doc. I think I told you once, me and my uh, another ball player at Miami, we had a bet who could eat the most of those little nasty White Castle cheeseburgers. They were there were 12 cents in those days, and the hamburgers and the cheeseburgers were 15 cents.
Oh,
And he ate 25, and just to be a 25 of them, and just to show that I was that much better, I ate 28 of them.
oh,
Now, can you imagine? I mean, I've eaten a couple of Big Macs, a couple of double burgers before. I know lots of people that have. So just imagine how much more salt. And that's just one meal. What about the rest of the day? And this drives me a little crazy, Doc, when I see people automatically salt their food. They haven't tasted it yet, but
I know.
automatically dumping
Salt.
the salt on.
Yeah, because
taste it first, folks.
yeah, because they're addicted.
Yes.
One of the greatest lessons I learned here in all of my training, it gets very complicated. It does, the chemistry and all of it.
Yeah.
But I try to find the way to really understand it. And this idea that food is not just food. Food can be a lethal kind of instrument to your health.
Yeah.
And we don't make it illegal because they're not like bullets. They're not like poisons, but in some ways they are.
That's right.
These foods, food can heal you and food can kill you.
That's
It's
right.
up, and people just, because it's on a grocery store shelf, they think, oh, it's just food. No harm here, no foul. Really? Not true. And so I hope we can at least try to get people to think about the idea that food is not just food, and to take it seriously, and to consider the supplementation that we talk about on the show, and to protect themselves this cold and flus and COVID-19 and RSV season with the Strauss immune support products.
Very good. Well, Doc, once again, we've come to our last minute on the show. Thank you again. That was great information today, and I hope some folks were able to listen in this Thursday evening, 8 p.m. Eastern Standard Time on the Truth Be Told Radio Network. You can contact Strauss. Have a look at the website at Strauss, Strauss, naturals.com. If you purchase something, use the coupon code TRUTH, TRUTH, for a 10% saving across the board. Or you can call Strauss toll free at 1-866-478-2873. Thank you very much for joining us today. Dr. Garko, thank you for your great participation as usual. And before I run out of time, I'm going to wish everybody a great day. God bless and stay as healthy as you can, folks. We'll talk to you next time. And that's it.